Well, when we talk about national strategy, what kinds of things might that imply? Because when you say that we already have bacteria here that is resistant to antibiotics, you start to become hopeless. So what kinds of things would a national strategy imply?
Okay, so it's a. I don't think one should be hopeless. I think that the whole issue is highlighted. More people need to understand it.
Yeah.
But there are very specific things you can do to reduce the spread of antimicrobial resistance, antibiotic resistance, reduce it happening. We've already identified the one thing, which is reducing the amount of use when it's not necessary. So the national strategy really is supported by three pillars.
Okay.
The first is you've got to know what you're dealing with. So you have to know what the resistance patterns are in your bacteria. Because if I know that, then I can give an appropriate antibiotic and one which only really attacks that bacteria.
Yeah.
We tend to use antibiotics which have what we call very broad spectrum. And that, again, what I've told you, that kills more types of different more different types of bacteria. And can relieve more types of resistant bacteria.
Okay.
So what we really want to do is treat a bacterial infection with a specific antibiotic for that bacteria. So you do as little damage, collateral damage, as you can. So by knowing exactly the resistance profiles in our settings, in our hospitals, in the country, we can then better tailor the antibiotics that we need. So that's surveillance and reporting. So that's the first thing we need to get better, improve. The second thing is antibiotic stewardship, and that's really talking about getting it right.
Yeah.
And so there are two aspects to that. The first is, as we've said, only treating people with bacterial infections, not viral infections or other things. Not people just who come with a fever who don't have an infection at all, perhaps, because temperatures can be caused by many things. And when you do have a bacterial infection, that you get it right. So you use the right drug at the right dose for the right duration, you monitor it properly, and you, what we call de-escalate to a narrow spectrum drug if you're using a broad spectrum, or if we have to use it in the vein, we then switch them to oral treatment, which is much easier and has less complications. And that's antibiotic stewardship. So surveillance, stewardship, and then the third important pillar, which goes hand in hand, is reducing the transmission of these bacteria, these resistant bacteria, between people, and particularly in hospitals. And the concern is that we are very bad as healthcare professionals at simple hand hygiene.
Really?
Absolutely. If you look at all internationally, and particularly in South Africa, if you look across the globe at hand hygiene audits in hospitals, they're almost always around 40%. So 40% of healthcare workers wash their hands properly, and that could be under soap and water or with an alcohol disinfectant. We need to really get better at that, because that's how you prevent the spread of those bacteria from a patient to patient in the hospitals. So surveillance, stewardship, and infection control. You have to have the governance structures. So there's a governance structure being planned at national level. And then from the underneath, you need a really strong foundation of education and public awareness.
Yeah.
And then you have your strategy. And we are working the South African Antibiotic Stewardship Program, which is a multidisciplinary program of infectious diseases doctors, microbiologists, infection control pharmacists, all stakeholders are working with the National Department of Health, who are leading this, towards a national strategy. It's in draft form at the moment. All the stakeholders have been involved. And that should be out very soon, and that will give hospitals, facilities, districts, and the people involved the blueprint of how to take this forward.